This is Lizzie Ma's Focus Assessment number 1. All right. Hi, is this Randall Young?
Yes.
Hi, my name is Lizzie. I'm going to be your registered nurse doing your assessment today. How are you?
Doing well, how are you?
I'm doing well. Do you mind verifying your name and your birthday just so we make sure we have the right guy?
Yes. My name is Randall Young, and my birthday is February 15th, 1987.
Perfect. Great. And then can you tell me why you're here today?
I'm just here for a checkup.
For a checkup. All right, excellent. So just from that, I can tell that Randall is alert, an oriented person, and time and place. He knows where he is. His responses are appropriate, and they seem to be fitting. And so it looks like you're 28 years old. You are 175 pounds, and you're 5'10". Does that sound correct?
Correct.
All right, and that seems appropriate for his age as well. And it seems appropriate from, I can see, his build. All right, and then let's go over your vital signs. Your blood pressure is 110/70. Heart rate is 65, which is also great. You're afebrile, meaning you don't have a fever. And your respirations are 16. And I can see that you have no increased work of breathing, no shortness of breath, and symmetrical lung expansion as well. And let's see, do you have any pain or any discomforts today? Or
No.
recently? Unexplained.
No.
No?
Nothing.
Excellent.
Nothing
Great. Great. And let's see, it looks like here you don't have any allergies. Is that still current
Yes,
information?
that's true.
Okay, great. Also, so first I would like to go ahead and have you, take off your socks and shoes and also your shirt because I'm going to be taking a look at your skin. Is that okay?
Mm-hmm.
All right, go ahead and do that for me, please.
Okay.
Are you all ready?
Yes.
Excellent, thank you. And so just from that, I can already tell that Randall has good posture. He's sitting upright in the chair. He is very alert and oriented, and his responses are very appropriate, and he is very interactive with me. I can also tell that he has good muscle movement and can follow directions and commands. All right, Randall. So first I'm going to touch your head and make sure that your head feels okay. Does that sound okay?
Yeah.
All right. So his head is symmetrical, nice round cranium, and I'm checking your hair here. It's shiny and thick, very appropriate for your age, and he's well groomed. And being this close to him, I can tell that he seems to have well hygiene and doesn't have any foul or unusual odors to him. All right. Next thing I'm going to do is I want to use a flashlight, and I'm going to be inspecting different areas of your head. So the first one I'm going to be doing is your eyes. I'm going to turn the lights down. Is that okay? So I
Yes.
can see better?
Mm-hmm.
All right, just a second. All right. So first I'm going to shine a light into your eyes. If I could have you look straight at my nose, okay? Just look straight at my nose. Good. One more time. Good, excellent. On this side now. Go. All right, now if I can have you look off into the distance, and I'm going to shine the light at you as well, okay? Just keep your eyes open at least. Okay, and I can see that both pupils are equally reactive to light, and the reflection of the light is symmetrical on both pupils. All right, now we're going to turn the light back on. And I can see that your eyes are symmetrical on your face. There doesn't seem to be any significant asymmetrical findings such as the eyelids or the placement of the eyes at all. And I can also see that his sclera is white with a little bit of pink, and I don't see any abnormalities there either. Next, I'm going to look at your ears. Okay, so both are symmetrical on the head. The helixes look intact and nicely circular. Looking inside of them, I don't see any abnormal discharges or findings or nodules or anything. On this side as well. Good. Okay. Next is the nose. Nose is midline. Skin is intact. Nasal airways are also equal. Can I have you look up a little bit? I'm going to take a look inside. Nose membranes also look intact and pink as well. Okay, you put your head down. Now I'm going to take a look into the mouth. Can I have you open your mouth? Stick out your tongue for me, please. Good, and that's an equal protrusion of the tongue as well. And the tongue also looks pink, a little bit of papillary dots on it. All right, can you put your tongue back in? Thank you, and just open your mouth again. I'm going to take a look inside. The rest of the oral mucosa is pink and intact. No abnormalities seen. Teeth and, taking a touch here, gums are also pink. Teeth are intact. No decay. Also, I can see the uvula is midline, and the tonsils are also looking good and non-swollen. Excellent. Can I have you close your mouth? Doing okay here?
Yep.
All right. Next, I'm going to be touching your face and just feeling for any abnormalities. You okay with that?
Mm-hmm.
Okay. My hands are a little cold. Sorry. Okay. So, sinuses. Any pain with this?
No.
Okay, those feel great. And touching here as well. These, what I'm feeling for here, can you stick out your chin? Thank you. Just relax a little bit, no. There you go. What I'm feeling here is for your lymph nodes. And you shouldn't really be able to feel them. If you feel anything hard, then definitely on one-sided, that's not a good sign. And you should definitely report that.
Okay.
And that feels great as well. I feel your carotids. And these carotids are the blood vessels that help bring blood to your brain. And both are 2+ bilaterally. Next, I'm going to feel your throat. I want to feel for your thyroid, okay? So I'm going to come behind you,
Okay.
all right? So let's touch here. And then if I could have you make a swallow for me. Good. And then one more time. Good. Excellent. So thyroid is midline and swallowing reflex is intact and symmetrical as well. Okay, so I'm also going to... Have you ever noticed any issues with your skin, sores, open sores, unusual openings, colors, discoloration, bumps, lesions,
Nothing out of the ordinary.
rashes, even like we're talking about your bum, places you wouldn't think that you would find them.
Oh, no. No? No.
Under your feet, between your toes, anything like that.
No.
No,
like that.
good. I'm going to take a look and see that your skin is equal color, not too much hair distribution. Let's see, no abnormal patches, lesions. Skin is smooth. Skin is also warm and it's dry. That's good. I'm checking. Your skin turgor is also excellent. That checks for dehydration. Do you mind if I have you put your hands like that? Okay, I'm just going to take a look at your hands. Also warm. Okay. And capillary reflex is less than 2 seconds bilaterally on all fingers. And I'm going to take a look at your legs as well and your feet. All right, can I have you put this leg up on my foot, on my knee? Skin is intact and we're checking bony prominence for any pressure, ulcers, checking in between the toes in case he was a diabetic. And I'm checking the turgor and the cap refill on the feet as well. And it looks good. Other side, please. Thank you. Checking under the heel. Skin turgor and cap refill. Also warm. Skin is warm and dry. No scaling, peeling skin. Thank you very much. All right, we're almost done here, Randall. Do you have any questions at this point?
No.
No, thank you. Okay. And lastly, I just want to ask if you've recently had any issues with memory or orientation, forgetfulness, anything like that?
No.
No? Okay, excellent. And then then also we have to ask all of our clients this. Have you had any time in your life when you felt threatened or at risk while you're at home for any abuse, or if you've had any suicidal ideations?
No.
No? Okay, excellent. If you ever feel like you need help in that area, you need someone to talk to, feelings of depression, nurses, any healthcare providers, always a person that you can come to for any help with that.
Okay.
Okay, I'm done here. Do you have any questions for me?
No.
No?
No.
All right, thank you very much. You can go ahead and put your clothes back on, and thank you.
Thank you.